medical and health professions panel coming in today. My name is Adriana. I'm the graduate advisor for Rosalind Franklin. We have Nina all the way to the right, and she's currently in the College of Nursing. She goes to Rutgers University. We have Jay, who's at New Jersey Medical School, first year. And we have Joanna, and she's currently doing her master's at UMDNJ. Please welcome them.
Do you guys have any questions first before, right off the bat? No?
Introduce yourselves.
Okay. Hi, I'm Joanna. I graduated Rutgers in 2009 with cell biology and neuroscience. I'm currently doing a master's at UMDNJ because it's been a little while since I've been in school, and I miss it, even though right now you're probably saying to yourself, I can't imagine missing school. But I really missed it, so that's why I decided to go back.
Hi, my name's Jay. I graduated this year, 2012, from Rutgers. I studied neuroscience. I minored in psychology. In my extracurricular activities involved EMT. I was very involved in Franklin, Somerset, and I also researched with the Arresti program. Currently, first year at NJMS, I'm taking anatomy, and with some of my time off, I come back to North Brunswick because I work as an EMT here.
Hi everyone, my name is Nina. I'm currently a senior at the Rutgers College of Nursing. I also work at St. Peter's as a nursing assistant, and I'm also doing research right now with a PhD student.
Let's warm the room up a little bit. What inspired you to do the careers you're currently on your way to?
I'll start. So when I was an undergrad, I did some volunteer/intern work at Newark Beth Israel in Newark. It's a hospital, and I had the opportunity to watch a heart transplant from beginning to end. So I drove with the ambulance all the way to get the heart. I saw them take it out, and then I drove all the way back, saw them put in a new person. So that's why I'm very interested in medicine, because it was kind of like you see like the whole process, like life, death, everything, and it was just amazing. So that's why I definitely want to go into medicine after grad school.
Like I said, was very involved as an EMT. It gave me the opportunity to interact with patients, learn how to talk to people, talk to family members. I also got to see a lot of different trauma-related calls, car accidents, falls, things like that. It's definitely the more gruesome side of medicine, and it's not for everybody, but it definitely solidified my goals.
I shadowed a physician my first year here at Rutgers, and I realized very soon that it wasn't the role for me. What a physician did was I did rounds with him. He's in general practice, and he spent about 5 to 10 minutes with each patient, which isn't exactly what I wanted to do, so I explored my other options, and nursing was more of a better fit.
So questions?
I have a question for the gentleman in the middle. You mentioned that
Just call me Jay. Don't do that. That's fine.
Okay, so you mentioned that you were an EMT. How exactly did you get involved with becoming an EMT?
Okay, when I was 16 years old, between junior and senior year of high school, I took the EMT course. Back then, it was 146 hours. It was full-time for about 5 weeks, 5 days a week. Before that, you also have to have your first aid and CPR already done. Now they've changed it a bit. It's 200 hours. It's basically going to be 5 or 6 weeks. After that, you can start volunteering. You can volunteer at pretty much all of your local squads are going to be a volunteer run. And then after that, if you're interested in working, you can work 2 years later in emergency services. There's also transport ambulances. I don't know if you guys see the smaller ambulances on the road. Those work with patients that need to be taken to the hospital or need to be taken to the nursing home. You'll learn less about emergency medical services and more about geriatric care, but it's definitely an important part of medicine. And if you want to start working right away, that's something you can do right after you take the course.
For Nina, did you go straight into the School of Nursing, or did you start out in a different school?
I started out here at the Rutgers School of Arts and Sciences, and then I transferred over.
That's exactly what I want to do. So how did you approach that?
Okay, so now back then it was a 3.0 to get in, and now it's a 3.3. What I did was, and I can give you the contact email if you want after this, I contacted Denise Santagello, which is the administrative assistant at the College of Nursing, and what she can do is kind of get you into the nursing classes, and you can kind of start to experience what the nursing classes are like, and I would take nursing classes now, like so nutrition and health, I believe. You can take next semester, take a stats class, things like that.
Thank you.
Anybody else?
So have you guys ever felt like discouraged along the way to go towards your profession, and what have you actually done to overcome that discouragement?
I'll actually start. So you guys, no one asked this question before, so this will be good because you guys are the only ones who are probably, and everyone over there will hear it. But as an undergrad, I knew I wanted to go into medicine. So I said, okay, junior year, I'm going to take my MCATs, I'm going to apply, and I'm going to get in after I graduate, and that's it, into med school. That's not how it happened. So I applied, I didn't get into med school, and I had to come up with this, oh, now I have time off, what am I going to do? And I was frustrated because I didn't want to do anything else. So I found a really good job at the Cancer Institute. I tried to improve my application. I tried to show ways that I'm still interested in doing medicine. I'm still going towards that goal, and I think that's something that you probably won't hear from everyone. Like, you won't hear stories about people that don't necessarily get in right away, because you hear everyone going, and it's great and it's good and it's a good motivator, but what happens when you don't? I think you have to make a choice if it's in your plan to go right away, and if it's not, what you're going to do in between, so that way you can still get to your goal. So I'm still going, so I'll let you know.
Going off of that, I think everybody gets the wrong idea that most people get in right out of college. I feel really fortunate to have, but once I got into medical school, our average age at NJMS for my year, which is the first year, is 25 and a half, I believe. I'm definitely on the younger side of my class, and across the country that's getting more and more common for medical schools, people take time off. I would say that's something you want to consider, whether it's to take some time off from college because you feel tired, whether it's because you want to work on your application. It's not a bad thing to consider taking some time off. Me personally, in terms of being discouraged, I walked in out of high school coming to Rutgers thinking that college was going to be as easy as high school was. I know a lot of you guys are taking chemistry. Chemistry was hell for me. I had like a 2.6 something at the end of my first semester. So if you guys feel discouraged by your first semester or your first year, I really encourage a lot. I guess I would say don't let it get to you this early on. I would say keep trying. You do have to figure out the best way to study for yourself and raise your grade if you're not doing well now. But a first semester or even a first year that doesn't go well is not like a death sentence to apply.
Just to add to that, no matter what you want to do with your career, your time here at Rutgers, whether you want to become a nurse, whether you want to become a doctor, or whether you want to take some other role in the science field, just remember that things like maybe a bad grade in chemistry, those are just roadblocks. You know, you will become what you want to do if you have the determination and motivation for it. Don't give up just because you got a C in Chem 101. That's not a big deal, you know what I'm saying? You have a long way ahead of you, and one little roadblock, one little stumble is just going to test you of how much you can push yourself to really become what it is you want to do.